Me, Dr. Debashree Guha, consultant pediatrician. I will start with today's discussion with care of newborn. To say care of newborn, we doctors usually emphasize some important aspects. Like first is feeding of newborn. Actually, what is the fact that newborn is just not a small size adult or small size children. Their internal system, functioning system is different from children, older children, and adults. So they are very delicate to handle and need more careful attention, some special care. First of all, is a feeding of newborn. What to give feed to a newborn baby? We doctors and all emphasize on exclusively breastfeeding, like not to give breast any other type of food, any water, or until medically indicated to a newborn baby for first 6 months. And that breastfeeding should be started as early as possible after birth if mothers and baby's health are stable. Very important is temperature maintenance. Temperature maintenance. What is that? Newborn baby have a tendency to become cold. Cold hands, cold feet. Even if coldness persists for prolonged period, whole body may get cold and they lead to some dangerous consequence. See, so we always emphasize to keep your baby always warm by covering your babies with clothes, proper clothing, socks, mittens for hands and feet. So temperature maintenance is very important for care of a newborn. Third, very important is hygienic handling of newborn. Newborn babies have the actual immunological system is very poor. They can get easily infected. So mothers and other caregivers who will care the baby, please wash your hands thoroughly with soap and water. Alternatively, you can use alcohol-based sanitizer before handling your babies. And keep in mind that no one other than caregivers should handle your babies. Another important, very important aspect of care of newborn is holding your newborn. So very simple. Baby's neck and head should be properly supported because neck holding does not occur until 1.5 months to 2 months of age. So during positioning your baby, it is important, very much important, to hold by keeping support to head and neck of the baby. Another very important part of care of newborn is burping. Please do burping of newborn baby after each feed. I'm coming later about the details of burping. So it is all about the basis important aspects of a care of newborn. Doctors encourage about feeding on demands, that the feed your baby when your baby demands. Usually baby gets hungry at an interval of 2 to 3 hours. So feeding at an interval of 2 to 3 hours is usually sufficient. And during each period of nursing or each period of feeding, give breast milk of one single breast totally, and it takes about 10 to 15 minutes. So each episode of feeding will take 10 to 15 minutes minimum and at an interval of 2 to 3 hours. Don't do frequent feeding to newborn. Frequent feeding may cause abdominal distension, may cause colic, abdominal pain, discomfort, irritability, and may vomit. So this is about the feeding of newborn. How to recognize When baby is hungry, he or she will gets awakened from sleep, become active, alert first from awakening after sleep. Then he will he or she will move their fists into the mouth. Head may turn to one side in search of mother's breast, may start constantly lip smacking like that. Constant lip smacking, this is a sign of hunger. And at last, if we does not pay attention to these first signs, baby start crying. So crying is a late signs of hunger. And one thing should be kept in mind that crying is not always the signs of hunger. So it is the late signs of hunger and as well as not the only signs of hunger. It is proper starting of other feeds after 6 months is very important to avoid proper nutrition and growth of the baby. I previously said that first 6 months only breastfeeding, exclusively breastfeeding that should be started as early as possible after birth. So after 6 months, milk is not sufficient for baby's proper growth and as well as after 6 months, teething is started. So it is very important to offer the baby some semi-solid to solid food gradually to meet the proper nutritional needs of the baby as well as to grow chewing habit of the baby. This is called complementary feeding. Complementary feeding that should be started at 6 months completed age of the baby. Now, what food should be given as complementary feeding during from this 6 months of age? We still recommend simple food and semi-solid food to start with, like boiled rice and dal, and with some vegetables, home available vegetables, sometimes smashed potato, smashed vegetables, smashed fruits like banana, apple, that can be offered to baby. And other types of food can be given to the baby like biscuits with added water. You can offer your baby sujis or semolina. So starts with this simple foods as complementary feeding at 6 months of age. To start with, give this food about 2 to 3 times per day, along with continue breastfeeding for rest of the time. Gradually, over the period of 1 to 2 months, start to increase this frequency of feeding, frequency of semi-solid feeding, semi-solid to solid feeding, that is from 2 to 3 meals per day to 3 to 4 meals per day, along with breastfeeding. Breastfeeding can be continuous up to 2 years of age, and this is beneficial for both mother and baby. I've previously said an introduction that about the care of baby. That is, the burping is an important aspect. Burping is needed to release the air that is swallowed by baby during feeding. So burping is done after each episode of feeding. If burping is not done properly, that swallowed air may cause discomfort to the baby, may cause irritability, may cause crying of the baby due to abdominal colic, and baby may frequently vomit or regurgitate milk. Now, how to burp your baby? There are some procedure how to burp your baby. You can hold your baby on your shoulder with the abdomen will touch baby's abdomen will touch your shoulder bit and lightly pat on the back of the baby for some times and air will be released. Another procedure, baby can be made sit on your lap with the abdomen touching your chest, and baby's chin will touch your shoulder. Gently rub or pat on the back of the baby and swallow air will be released. So this is about burping of the baby, and this is very important. Sometimes mothers or parents are worried about how much your baby should sleep, and baby's sleep pattern is somehow different from older children and adults. How it is? A newborn baby may sleep for a prolonged period in a day. That may be about 18 to 24 hours in 18 to 20 hours within a period of 24 hours. This is usually first few days and months of life. Another is at a stretch of sleeping may range for 10 to 15 minutes with short stretch of sleeping, and that may be prolonged sometimes to 3 to 4 hours at a stretch. Both are normal, nothing to be worried about. And another peculiar pattern of sleep of newborn baby, that they usually awaken during most of the time during night and sleep usually during the daytime. And this is usually persist for first 2 to 3 months. Sometimes for few babies it may last for 4 to 5 months, even 6 months. Then the cycle is altered like our cycle, that is sleeping during most of the time during night and awakening during daytime. So nothing to be worried about this sleep pattern during newborn period. Very important part of newborn care is vaccination. Birth vaccination, there are 3 birth vaccination that should be given to all newborns, preferably within 24 hours of birth. But keep in mind that baby should be healthy. Baby is having no illness within first 24 hours. You give this birth vaccine. What are those? First is BCG. BCG. What is BCG? What will protect? BCG will protect what? This BCG will protect from disseminated tuberculosis. That is a severe form of tuberculosis, and that BCG should be given after birth. Another is hepatitis B first dose. So hepatitis B first dose to be given just after birth, preferably within 24 hours. Another is oral polio vaccine. Oral polio vaccine 0 dose. What is 0 stand for? This is for sensitization of a newborn baby against polio. So 3 this vaccine, BCG, then hepatitis B first dose and oral polio vaccine 0 dose. These 3 vaccine must be given to a newborn baby just after birth. This vaccination schedule will continue at 6 weeks, 10 weeks, 14 weeks, then 9 months, then 15 months, and onwards, then up to 5 years of age. So, vaccination of newborn babies includes these 3 vaccines to be given within 24 hours after birth. Diaper of newborn babies should be changed frequently. Usually, we recommend it to change within at interval of 2 to 3 hours or earlier if it is already full. If baby wear this diaper, weighty diaper for prolonged period, that may cause diaper rash. That is the one type of fungal infection or allergy near the diaper area, that is around the genitalia. So it is very important about the diaper care. Diaper should be changed at the interval of 2 to 3 hours or earlier if it gets full. First birth to be given to a newborn baby after 6 to 24 after birth if your baby has no as such illness. And then this bathing will continue at an interval of 2 to 3 times per week. Too frequent bathing is not needed for newborn babies. Too frequent bathing may cause dryness of the skin. So, how often? That is interval 2 to 3 times per week. Bathing is sufficient for a newborn baby. And during bathing, use gentle cleanser and water. Don't use any irritant substance like Dettol like this to clean your baby's skin. There are some practices still in societies for about the newborn care that are seen rather harmful rather than they are beneficial. So as doctor, we usually discourage that practices. Like massage of baby with irritant oil, like mustard oil, that cause rashes on baby. So that should not keep in mind about the massage with mustard oil. You can use coconut oil during massage of baby. Sometimes we use kajal and surma to put on baby's eyes. We strongly discourage about this use of kajal surmas to newborn baby. We recommend keep the navel or umbilical cord of the newborn baby should be clean, nothing to apply to the cord. Another is we strongly discourage about to give milk or food other than breast milk to newborn babies. Others are, I already said, that should be keep in mind that no one other than caregiver should frequently handle newborn baby. Newborn babies may get infected. So these are all about.